there, my name is Chris Dirksen. I'm a student nurse, and today we're going to talk about the reconstitution and implementation of cloxacillin through IV piggyback. So let's get started. I'm going to do some hand hygiene here. We're going to compare our MAR to our doctor's orders and also our vial of medication here. So we have our cloxacillin, 1 gram IV every 6 hours. So we want to make sure that we have the right drug, cloxacillin. This is a 1 gram dose and we have 2 grams in here, so this will be enough. We know that it's IV use only, and every 6 hours. So if we look at here, we can see that it says the last dose was 6 hours ago, so we'll be giving the next one now. We can also see that our patient is there. We have the right patient. So I have Clark Kent as my patient. We'll talk about him in a few minutes. So next we're going to move on to the parenteral monograph for cloxacillin. So you want to look right away, make sure that a student nurse can give it, and they can, so that means I'm okay. The usual dose is 1 to 2 grams, IV every 4 to 6 hours, so that totally fits with what I have. So for the 1 gram ordered dose, we are going to make sure that is diluted with a 100 milliliter mini bag. So I want to look here, and I have my 100 milliliter mini bag of normal saline. The final volume, we'll talk about that in a minute. So our final concentration, we have all that. And it is normally given over 30 to 60 minutes. So because my patient doesn't have anything for the rest of the day, it'll be given over an hour. So when we're gonna talk about our concentration and how much we're giving, I have 2 grams in here. And so to reconstitute it, we add 6.8 milliliters of sterile water. We get a final concentration, or a final volume, sorry, of 8 milliliters and then a concentration of 250 milligrams per ml. So if I'm going to take these 2 grams and put it into 1, I'm gonna have to take half of what is left in there. So I've done the math here. And at the end, I will be taking out 4 milliliters, which is going to equate to 1 gram. So that'll fit our dose. So we have these 2 here, and so we're gonna get started with the medication preparation. So I'm going to be swabbing these. Now, for the sake of the video, I'll just be doing it a little quicker, but normally we would be doing 30 seconds wiping and then 30 seconds drying. So we're gonna wanna do this here, and then so we're gonna be letting them dry for 30 seconds each. Perfect. So then I'm going to use my 10 milliliter syringe here. I have my blend fill as well. So we're going to be taking these out, and this is what I'll be using to take out water and then finally the medication later. Open this up. Should we get that in there? Okay, perfect. So we're going to take out 6.8 mLs of sterile water. So I'm going to take up 6.8 mLs of air to inject. Make sure you get that in there. Perfect. So, injecting that into here. All right, and then we'll inject the air. And then we'll be taking out our sterile water. And there will most likely be bubbles, so we're gonna need to take those out as well. All right, so. Oh, cap went flying there. Come on. There we go. Okay. So make sure you got that right amount. Perfect. All right. So take that out. And then we'll be injecting it into our cloxacillin vial here. So. And then we're going to let that air to come out as well. So we're going to want about 6.8 mLs of air after, get rid of the pressure. All right, good. And now I'm going to recap this for sterility, and then we will reconstitute the medication. So while I'm doing this, I'm just going to talk about why my patient is getting cloxacillin. So Clark Kent here, he is not from our universe. He is from the planet Krypton. I don't know if you know about that, but so he's new to our environment, and because of that, he has a weakened immune system. So he has contracted some pneumonia from some sort of bacteria. So we're going to be giving him this antibiotic for that reason. Yeah, and I'll be explaining that to him as well, sort of why he's taking it. So now that we've reconstituted this, we're going to be injecting it into here. So before we do that, though, we're going to want to take it out and then also do our second med check as well. So now that I have this, we're going to want to make sure that I get my 4 mLs of air, because we're taking out 4 mLs from the final volume of 8 in there. So, before I do that, let's do one more swab. So again, 30, and then we'll let it dry for 30 as well. So like that. So now I'll be using, make sure I have the 4 mLs of air in there. Insert into there. And then insert the 4 mLs of air. And then you're going to want to draw out 4 mLs of your medication. Alright, so then you're going to have some bubbles in there as well. There we go. Okay, perfect. Make sure it's still the right amount. Okay. So now we will be recapping this again for sterility. So before I insert into my mini bag, we're going to want to make sure that we do our second med check. So we're going to confirm again with what's going on here. So we're going to look at the right drug. We have cloxacillin. We have our right patient, Clark Kent. We know that we're giving 1 gram IV every 6 hours. So we know that the last dose was 6 hours ago. We have our right route, IV. And then we know from the parenteral monograph and the math that I've done that we need to take 1 gram, and that's going to be 4 mLs from the final volume of 8 in here. So second med check is all done. Now we're going to be wiping this down. So again, we're going to do 30 and 30. So 30 and 30. Now we will be injecting into our mini bag there. Okay, good. And now this is done with, so I can toss it in the sharp. So I'll just put it off to the side here. So now that we have this, we want to make sure that we have a label for it. So I've drawn one up already. So this is for Clark Kent. We have the drug, the dose, the amount that's going to be in here. So 104 milliliters in total. I have the final concentration and dilutant on here, as well as the date and time and my signature. And I'll let you kind of just look at that. Started. Okay, good. So I will take this off. If my fingers will allow me. I'm a little nervous, sorry. Put that on there. All right, and so now we are ready to head into the patient's room and actually hook all this up. So we want to make sure that we have everything. So I'm going to have the MAR with me again for the third med check. I'm going to have the mini bag itself, our secondary tubing kit. These I would leave in the med room, but I might use it for my third med check today. And I also have this, which is going to be my tag for the secondary lining of tubing, as well as a few more of these, which I will be using for the IV site in a minute, or the connection site. Other than that, I think we're ready to head into the patient's room, so we will mosey on down over here. So we will enter the patient's room, just perform a general safety check as we come in, introduce ourselves to the patient. So, hello, Mr. Kent. My name is Chris. I'm your student nurse today. So we're going to be administering some medication for you, and then at this time, you also want to double check that you look at the armband and you just confirm, do you know your full name and do you know your birthday? Just get that ANO times 3, make sure we know who this is. And so we're going to explain what this medication is. So, Mr. Kent, we're going to be giving you some cloxacillin for the infection that you have for the pneumonia. So the common side effects of this drug are nausea, vomiting, and diarrhea. So if you do have any of that, please let me know, and we will attend to that accordingly. Do you have any questions? He's been very quiet all day, so luckily he doesn't have any questions for me. And he does have the right to refuse at this time as well, just to note. So now we're going to be getting ready to hook all this up. So we're going to be spiking our bag here. And before we do that, I'm going to choose to just take this down a little bit. So this up like so. Good. All right, so we're going to be inserting this. So we know that these are both going to be sterile, so when I take these off, we want to not be touching them at all. And then we're going to spike our bag, like so, okay. And make sure that clamp is on so it doesn't go flying everywhere, good. So now I'm going to hook this up over here. And also at this time, I want to mention, I didn't do it quite yet, but you want to make sure that you do that third med check. So you would be looking at the drug here. You would want to make sure, okay, cloxacillin, you have your MAR, double check cloxacillin, and you also have the patient there, so you want to check Clark Kent. We know that this drug is 1 milligram dose. We have our 1 milligram there. We know that it was last given 6 hours ago in IV, so we need to give the next dose now and IV. So now we're going to be inserting into the connection site, so I'm going to be wiping down this port here. We want to make sure that it is before the pump there so that the pump can better regulate it. So we have here, so we'll do 30 and 30 like before. Okay, good. So now we're going to be connecting, and this is also sterile once this cap is removed, so make sure you're not touching any of that there. So you want to have that there. I'm going to drop that cap. Okay, so this is good now. And so now before we start anything else, we want to make sure that we back prime and get all that air out of the tubing. So we're going to take this down, open up the clamp, just want to see, so we can see that there's air returning there. There's going to be fluid filling up the drip chamber. Probably going to have to get rid of some of that. So you want to make sure that all the air is evacuating out of the tubing there. There's no kinks in the tubing at all. Okay, so I'm just going to get rid of some of that excess fluid. Have that. All right. Now we'll be setting it up here. I'm just going to put that clamp on again before I start the infusion. So now we are going to set up the secondary infusion. So we're going to press secondary, and we need our volume and our rate. So we know that the rate is going to be 104 milliliters because we are infusing the 104 milliliters over an hour. So 104 an hour, and then we're going to say 104 mLs need to be infused as well. So you'll press confirm secondary, press start to begin secondary. So it's starting, and I'm going to unclamp this so that I can let it flow. And at this time also we want to make sure that we attach this bad boy on here. And then we also want to look for our 3 drops there. So I've already seen 1, and you want to look for another 1, 2, and there's 3. So now that we know it's working, we'll just talk to the patient. We'll say, okay, so now the medication is infusing. I'm gonna come back in about 10 minutes and just make sure everything's running smoothly, and then in an hour it should be done, and I'll come back and check up on you. And at that time you wanna do the right evaluation, check on how their symptoms are doing, if they've improved at all, if anything's going wrong. And then also, now that we are done, I will be documenting, so I'll just name, date, and time, and then we can head out of the room. And that's just about it. Thank you very much.